This is New York Nightly News with Chuck Scarborough.
Education not the only big target for the budget acts. Healthcare also facing some major funding cuts. Governor Cuomo's Medicaid design team has proposed moving Medicaid patients to an HMO-style managed care system and changing the way doctors prescribe drugs to their patients. Here to talk about why he is against those cuts, Seth Ginsberg, president of the Global Healthy Living Foundation. Thanks for joining us tonight, Seth.
Hi, good to be here.
So your organization was one of many groups that headed to Albany earlier this week, lobbying lawmakers to reject this proposal. Tell me why.
Well, we sat down with the governor's top aides in healthcare, and we explained to them that those who receive Medicaid, 1 in 4 New Yorkers, our most vulnerable people, need to be better taken care of, especially when it comes to prescription drug access. And so the Global Healthy Living Foundation, we feel strongly about the need to not put managed care, bureaucrats, people who make decisions based purely on economics, between a doctor and the Medicaid patient they're trying to treat.
What's the difference between managed care and how Medicaid is run right now?
Good question. So currently, in a law signed by Governor Pataki, prescription drugs for those receiving Medicaid went through the state. And the Medicaid redesign team, which was a board of people representing all kinds of healthcare interests except people actually on Medicaid, decided to recommend to the governor that we ought to put a managed care organization between the doctor and the patient. And so what that means basically is decisions will be made purely on economics, not on health outcomes. And while it might be nearsighted to think we'll save some money, if you look closely at it, number one, they won't save money because a lot of drugs are going off of patent and will become dramatically cheaper. And more importantly, number two, the sickest people will get sicker and they will have to be hospitalized. They'll have to go back to their doctor. It really is a mess.
For the other side here, Governor Cuomo's team here trying to redesign and save the state some money, they are saying that this will give patients access to the most cost-effective drugs, that the physician prevails. So we've heard a lot about this, allowing physicians to override New York's preferred drug list, that it was hardly ever used, that the physicians who used it during the last year for only 3,000 out of 50 million Medicaid prescriptions were written. So only 3,000 out of the 50 million this actually applied to, this Physician Prevails program.
We could talk numbers.
So they're saying it's not going to impact that many people.
I think I can appreciate their position, but
yeah.
The reality is Governor Cuomo is a national leader. What he does with Medicaid, 49 other states are watching to do as well. And when we take a close look at the numbers, we're talking about 3% of the Medicaid budget, which is over $57 billion, 1 in 4 New Yorkers on Medicaid. So 3% dealing with prescription drugs shouldn't be where the governor is looking to take cuts. Instead, it's these managed care companies. It's the people with the hospital unions. It's all these other healthcare interests that have been at the table where the cuts ought to be a lot more closely examined.
So, Seth, how do you suggest saving the state $139 million? Because they claim that's what this proposal will do. And what, in fact, are you asking lawmakers to do?
We know the governor and his staff are watching this because this is very important to them, as I said, as national leaders. And while we don't have the specific answers that would save that specific amount of money, we know conceptually, the Global Healthy Living Foundation, that not only the provider must prevail in whatever he or she decides is important, but the patient has to prevail. We need to base our medical decisions on outcomes, on science, on what's going to make these people healthier. It's in keeping with President Obama's Affordable Care Act, the charge to make the outcome of patients healthier, make New Yorkers healthier. It will be better in the long run.
Seth Ginsberg, president of Global Healthy Living Foundation, thank you for joining us tonight.
Good to be here.